This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us.
Mental health.
Part 2.
Let's now turn our attention to eating disorders. Compulsive overeating is binge-like overeating without purging. There is a lack of control over food consumption. With anorexia nervosa, the onset is often associated with a stressful event. Death can occur from starvation, suicide, cardiomyopathies, or electrolyte imbalance. Look at the picture on your screen. Just look at the havoc anorexia nervosa can cause. Most people with anorexia are female. An anorexic has a low body weight for his or her height. They resist keeping a normal body weight. They have an intense fear of gaining weight. They think she or he is fat even when very thin. Often women miss 3 menstrual periods in a row. With a depressed client, what is your most important assessment? Access for suicide. Did you know over 50% of all people who die by suicide suffer from major depression? It's important to obtain a history. A previous attempt is the most important risk factor. Substance abuse, thought disorders, or other medical problems are other risk factors. Evaluating suicidal intent. In evaluating suicidal intent, always directly ask the client if they're thinking of harming themselves. If ideation is present, ask about plans and planned method. Determine if the method is available.
Grief is a very important topic, so please pause this video and go to YouTube and Google Grief Giraffe. Watch Grief Giraffe and return here for us to continue our lecture. Did you watch it? What did you think? Let's quickly review the 5 stages of grief: denial, anger, depression, bargaining, and acceptance. Denial is the first reaction to learning about a terminal illness, a loss, or death of a cherished loved one. It is a defense mechanism that buffers the immediate shock and carries the client through the first wave of pain. Anger follows when the initial effects of a denial begin to wear off and reality and its pain reemerge. In the bargaining stage, the client may secretly make a deal with God. Depression can come in 2 forms: extreme sadness or be more private. It is the client's quiet preparation to separate and to bid his loved ones farewell. The acceptance phase is marked by withdrawal, acceptance, and calm. What can put your patient into the stages of grief? A death, terminal illness, failing, divorce, loss of a loved one, loss of a job, and our list can go on and on. Remember to recognize the stages of grief when treating our patients. Anxiety. Anxiety can range from mild all the way to panic. The types of anxiety include mild, which is tension of everyday life; moderate, immediate concerns; severe, feeling that something bad is about to happen; and panic, terror, and a sense of impending doom. Nursing interventions. Decrease stimuli in the environment. Phobias. A phobia is an irrational fear of an object, activity, or situation, like sitting here and listening to me tell you about phobias. Most people recognize it as unreasonable. It is associated with panic-level anxiety. Defense mechanisms used include repression and displacement. Dissociative disorders. This includes the inability to remember important information due to an extremely traumatic event. Dissociative identity disorder. 2 or more distinct identities, and at least 2 of these identities recurrently taking control. Depersonalization disorder. persistent or recurrent episodes of feelings of detachment from oneself. Obsessive-compulsive disorder. Remember, let your client finish the ritual. Benzodiazepines have anxiety-reducing, anxiolytic, sedative hypnotic, muscle relaxing, and anticonvulsant actions. Flumazenil, Romazicon, is the antidote. It is administered intravenously and reverses benzodiazepine intoxication in 5 minutes.
Remember, you are more than a conqueror, and you will be successful. Join me as we review core content in the next unit.